It's important to note that sedentary behavior, including sitting with devices, increases cancer risk by 14 to 20%, according to Brown and colleagues in 2019. Sedentary behavior should be discouraged, physical activity encouraged. Health professionals are well placed to provide specific advice, addressing obesity through diet and physical activity. Recommend 20 to 30 minutes of daily exercise. And in fact, this amount is ideally for adults. Children should get double. Children and adolescents. Next, recommend BMI under 25. All right, so 25 to 30 is considered overweight. Over 30 is considered obese. And also low visceral fat is very important. They found a relationship between visceral fat. I learned about this in the recent American Association for Cancer Research. The abdominal fat is worse than fat carried on the hips as far as cancer risk. So BMI. BMI is a bit of a troubling number because it doesn't take into account what the weight is from. It's just a raw number of weight versus height. So someone could be well built, and generally Africans have a higher healthy BMI than Caucasians, who in turn have a higher healthy BMI than Asians. All right, and men have a higher healthy BMI than women. So more muscle, more bone is not a problem. What we're talking about really is the amount of fat, okay? And so another way to measure would be waist circumference or waist to hip ratio. But there is a strong correlation between BMI and several types of cancer. It's dose related. Every 5 BMI increases endometrial cancer risk by 50%, esophageal cancer risk by 48%, renal, hepatic cancer by 30%, gallbladder cancer by 25%, gastric cancer by 23%, breast cancer increased by 13%, multiple myeloma 12%, colorectal cancer, pancreatic cancer 10% increase, prostate cancer 8%, ovarian cancer 6% for every 5 BMI. This is according to Coombe and colleagues in 2018. And so we should recommend lowering and balancing calories with activity. Advise specific dietary changes to be made and consult about goals. For example, avoid or reduce high glycemic index intake, avoid sugar drinks, fried foods. In fact, it's possible just to reduce overall caloric intake. According to animal models studied by Wu and colleagues in 2017, they found 15% to 53% reduction in caloric intake resulted in a 20 to 62% reduction in incidence of tumors. Conversely, high caloric intake equates to 56% higher risk of colorectal cancer. All right, so it's not always possible, unfortunately. If fasting is followed by binge eating, then there might be no benefit. All right, so these researchers, they are they're consistently restricting calories in order to reduce the amount of tumors. The good news, and I know it's difficult, and this is one of the issues that has been raised in the conference, as well as by the researchers, but evidence does suggest that behavioral 6 to 12 month programs tend to help individuals who need support lose 5 to 10% of their initial weight. Okay, and these may be group-based. They may involve dietary counseling, assistance regarding calorie reduction, practical encouragement, and also some, touching on the physical activity. It's important to let people know that nearly 1 in 3 cancers are due to weight and diet. Okay, and this combination may soon overtake tobacco as the primary modifiable risk factor. So the possibility of cancer may serve as a teachable moment. Of course, a prognosis definitely will as well, motivating people to make important lifestyle changes. Hopefully, health professionals can help provide the guidance and encouragement. You know, it's an important question to ask. How can physical activity be achieved? And encourage patients to make a plan. Inform them of consequences that may result, the likelihood of the consequences if change is not made. The guidance tells us that women over BMI 25, men over BMI 27, they should make weight loss a priority. And we're talking about slow and steady weight loss, not sudden weight loss, all right? It can be best achieved by lowering caloric intake and increasing expenditure. So it's the combination of diet and exercise. Most of the increase in caloric intake is due to sugary beverages. These last comments, all from Clinton and colleagues, 2017. And so those sugary beverages should be minimized. Health professionals should advise risk-reducing surgery for those at high risk and those likely to benefit. Okay, so this is referring to mastectomy, oophorectomy. They can be considered for those with family history who are at risk, at a high risk, for example, higher than 20%, because of adverse genetic mutations, such as the BRCA 1 or 2. Mastectomy has reduced cancer risk in those with the BRCA genes by 90%. When combined with oophorectomy, the mastectomy and oophorectomy can reduce the risk by 99%. All right, so that saves lives. Of course, people might be concerned about cosmetics. There's a nipple-sparing surgery, and the benefits are very similar. And so that might be a good oncologic as well as cosmetic option. Oophorectomy on its own can reduce cancer risk by 50%, according to Gulem and colleagues in 2019. So this salpingo oophorectomy, according to Finch and colleagues in 2006, it can reduce ovarian, fallopian tube, peritoneal cancers by 80%. All right, so this is not a recent thing. People have been aware about this for over a decade. The combination of oophorectomy and mastectomy, according to Kalachand, 2017, and his colleagues, that combination can reduce breast and ovarian cancer risk by over 90% in BRCA 1 and 2 mutation carriers. Okay, of course, there's also chemo prevention, and some patients might prefer to continue with screening to keep on top of their risk, and that will also allow them, for example, to rear the child. For those with risk of colorectal cancer, because of polyposis or adenomas, it's possible to undergo colectomy or proctectomy. RET mutations, they might indicate thyroidectomy to prevent thyroid carcinoma. And interestingly, bariatric surgery may reduce risk of obesity-related cancer. Brown and colleagues in 2019 reported that it may reduce the obesity-related cancer risk by 27 to 59%. Coombe and colleagues in 2018, they stated that there's a lower risk for those who are morbidly obese, reduced risk of 24% cancer incidence for obesity-related cancers. And in fact, a 46% reduced in the hazard risk, 46% for all cancers. And they also mentioned that those results are supported by other studies. Okay, and cervical precancer can be treated with cryotherapy, loop electrical excision, cold knife conization. So I talked previously about HPV prevention through vaccination, and also screening, the success of cervical screening, which must be complemented by good treatment. Those with HPV might benefit from frequent screening and then treating that pre-cancer, especially before it becomes invasive.